with glass cups and fire. The fire goes nowhere near your skin, but we use it to create a temperature difference that creates a suction. So you can do it a couple different ways. We can do it like this, where you just pick a couple acupuncture points and put them on there. It's going to increase that blood flow in the area. Or if you have a muscle knot in that area, you can use it as a deep tissue massage technique. And also, if you put down some lotion or oil first, you can move them around.
Wow, that's awesome.
Yeah. So it's kind of like the opposite of getting a regular deep tissue massage where you're pushing down to work out knots. This is actually using suction, and it lifts the muscle and fascia in between the skin.
Wow. I can feel the suction too. It's hard to explain.
Okay, zigzag them around, and basically you just kind of do it until you see a real good red response in the skin, meaning that blood flow's going. You see this a lot in sports athletes these days too. You'll see it kind of looks like they got in an argument with a vacuum cleaner or something. They got hickey looking marks all over them.
Yeah.
That's generally from cupping.
Wow. So do you get red marks when you move them around consistently?
You can, yeah.
Okay.
Just kind of depends on how stagnant the blood is. If it's not flowing real well, that's when you tend to get the more darker marks. And then too, just how strong we make the suction. And it's definitely an art form and not a science, so every time we put them on, it might not be as strong as the next time.
Okay. How often should you get cupping done to your back or muscles?
Just really depends on what you have going on. You know, if you have a really tight chronic hypertonic back, then you probably want to get it done a couple times a week. It probably follow a similar timeline as massage therapy when we're talking about it that way. And for acupuncture, you know, if we're dealing with something pretty acute and we're seeing you 3 times a week, then we want to do it 3 times a week along with your needles.
Okay.
So I like to kind of move around, get things flowing, and then we'd pick a couple really good spots, like for you, probably be out here. And then we would do this while you're doing your needles. So we'll put your needles in, then we would just leave them there that whole 15 minutes.
Okay.
So we'll get a little bit closer view here. You can see that skin got nice and pinked up.